Well, how about this story? Local and world health leaders are now warning against a French study that says there is a lower infection rate for smokers among COVID-19 patients than non-smokers. For more on this now, we welcome in our Shira Matsuzawa. Shira, what are the health experts saying about this study? I can't imagine they concur.
Absolutely, you're right there. Well, they're simply saying that there's no evidence to back this up and that smoking can actually put you at a higher risk of dying from the virus. And we first brought you this story here on KTVB a few weeks ago. The controversial study was done by French researchers who say that only 5% of those who have died from the coronavirus smoked, but 25% of the general population smokes. They explained that nicotine and the COVID-19 virus bind to the same cell receptor and that nicotine is able to block the virus from attaching itself. Now, it's important to note that this is just a hypothesis. Nothing has been published, and health experts say that is part of the problem with this study. Now, Gabrielle Davis, she works for St. Luke's here in Boise, and she said that after we aired the story, she received tons of calls and texts asking her if they should start smoking and vaping again, and the short answer, she says, is no. But she also added that the data in this study may not be accurate because people aren't always truthful.
Now, the caveat to that is there's so much stigma around people who smoke and vape. It's not often that you find people that are willing to be truthful enough with their addiction because we have stigmatized those folks and people with nicotine addiction for so long.
As for the World Health Organization, a few days ago, they released this statement about the study, saying there's insufficient information to confirm any link between tobacco or nicotine in the prevention or treatment of COVID-19. They also say that smoking impairs lung function, making it harder for the body to fight off the coronavirus and other diseases. And in fact, Mark, they say that smokers are more likely to develop severe disease with COVID-19 compared to non-smokers.
Yeah, when that study came out, there were a lot of people raising their eyebrows and questions.
Right.
Thanks for setting the record straight, Shira.